When it comes to treating metastatic breast cancer, it's important to take care of both your body and your mind. This means not only getting the best treatment, but also making sure you're getting the most out of that treatment. To do this, it's important to have open communication with your care team, so they can track both the physical and emotional effects of your treatment. It's also important to address any obstacles and advocate for yourself to get the care, financial assistance, and support you need to manage the side effects of your treatment. While this may seem overwhelming, there are resources available to help you every step of the way. When you're going through breast cancer treatment, it's important to communicate with your cancer team about how you're feeling. Many women don't fully share their details with their doctors, which can make it hard to make adjustments to help you feel better and stay on track with your treatments. Your doctor may not always ask about how you're feeling or any side effects, so it's up to you to start the conversation. Talk about any physical side effects, like loss of appetite, nausea, fatigue, or hair loss, as well as emotional side effects. Be specific with your team so they can provide the best supportive care for you. Keep track of your side effects and discuss them with your team, as they can change over time and new ones might start. It's also important to talk about your emotional and social needs, as this can have a big impact on your overall well-being while you're living with cancer. You can also ask about complementary treatments like acupuncture, yoga, or mindfulness to help ease both physical and emotional side effects. These therapies can be a helpful addition to your overall care plan. Racial biases in the medical system can make it feel like you're not getting the information or respect you deserve. Efforts are being made to make care more equal, but you can also be your own advocate. You can connect with organizations that will advocate for you and help you get the best treatments for your specific type of breast cancer. Look for patient navigator programs in your area to help guide you through the healthcare system and overcome barriers to care, including racial differences. And consider joining a community-based breast cancer support group for a wide range of services to meet your needs. When it comes to breast cancer and healthcare, financial hurdles can be just as challenging as the treatment itself. Whether you have insurance or not, the costs of co-pays, deductibles, and medications can be overwhelming. However, there are several ways to get help with these bills. Social Security Disability, SSDI, offers payments to those who have previously worked and paid into Social Security. You can apply for faster processing through the Compassionate Allowances program. Free or low-cost health services are available depending on your income, such as through America's Essential Hospitals or Hilberton facilities. Many drug manufacturers offer patient assistance programs for low or no-cost medications if you meet certain financial criteria. Websites like Medicine Assistance Tool and NeedyMeds can help you find these programs. Financial assistance organizations like the Cancer Financial Assistance Coalition and the Komen Financial Assistance Program offer grants and financial aid to underinsured cancer patients, including those with metastatic breast cancer. The Assistance Fund and Genevieve's Helping Hands charity also offer programs to help cover medical expenses for breast cancer patients. The National Council on Aging's Benefits Checkup Search Program can help older Americans with limited income and resources find prescription drug assistance and other programs. During and after breast cancer treatment, it's important to take care of your emotional well-being. One way to do this is by joining a support group. These groups can be found nationally and in your local community, and they offer both in-person and online meetings. By connecting with other breast cancer survivors, you can share experiences, learn about local resources, and find better ways to communicate with your medical team. Research has shown that women who engage with other survivors experience emotional and physical benefits, such as reduced pain, improved mood, and even higher survival rates. It's worth noting that Black women are less likely to have access to these support networks, so it's important to address this gap. In addition to group support, you can also seek one-on-one support through organizations like Living Beyond Breast Cancer's Breast Cancer Helpline and the Chrysalis Initiative. These resources offer individualized coaching and support tailored to your specific needs. Many organizations are dedicated to supporting women with metastatic breast cancer, particularly women of color. These organizations offer a range of resources and support, including support groups, educational materials, retreats, coaching, and online learning opportunities. Some of these organizations include the African American Breast Cancer Alliance, the Chrysalis Initiative, For the Breast of Us, Latinas Contra Cancer, Living Beyond Breast Cancer. The Metastatic Breast Cancer Alliance. Sisters Network Incorporated. Touch, the Black Breast Cancer Alliance. Each of these organizations works to provide educational resources, patient navigation, and support group services to underserved and low-income women of color. They also offer a variety of programs and services, including virtual conferences and advocacy work to improve the lives of people with metastatic breast cancer.